There. So there are two conditions where you can do this. Either acute post-operative within 3 months, or you have a well-functioning implant index surgery done long back and the patient is presented with acute symptoms of 1 week. So not necessary. 5 years he was fine, he has come to you, only 1 week symptoms, that's acute hematogenous spread. Or acute post-operative within 3 months, these are the two conditions you can do this. Well-fixed joint with proper alignment is a must. You should have a good soft tissue envelope, no chronic draining sinus, and preferably the microorganism should be susceptible when you attempt the DAIR. The late chronic infection success rate is less. Avoid in fungal and multi-drug resistance. Avoid in failed previous DAIR. So don't try to do that. And immunocompromised patients, your results are going to be compromised. This is your lifeline. Do not waste this opportunity. This is not a simple surgery. Timings is very important. You should do it as early as possible. Do not sit on it. Do not waste the time. And if you do it early, and that is the most important factor which can influence the final outcome. So do not waste the timings. As we have said, acute hematogenous spread has got a less success rate compared to acute post-operative period. Chronic infection that becomes significant by acute exacerbation increase bioburden. You sometimes don't know. He may have presented within 1 week, it must be going for a long time. So the success rate is less in that. This is not a washout. Don't give it to juniors. Don't do it last in the day. You just give proper attention to the debridement. Arthroscopic lavage has no role. Take 5 tissue samples from 5 different places and send it for the microbiology and histopathology, and per-operative antibiotics to be given only after the sample collection. Radical debridement, excision of potential infected tissue or non-viable, it is the key for the surgery, a success. Modular implant is a very important factor, and there are lot of reports which says that this is one point which can help to improve the outcome, because it gives you access to the posterior part, it removes the biofilm which is there on the plastic. So this is exchange of modular component has been an independent factor along with the timings, as we already discussed. Poly exchange, as we are saying, so DAIR is not a very good procedure for all poly. So you should be very careful about it. Sometimes the poly which you take out, you can send it for sonication, because that biofilm may help you to get the biobacteria if you don't have. So as we already said, these are the two important factors, the interval between the index and the modular part exchange. These are the two important points we should keep in mind. The fluid, sorry. So fluid and bacterial antiseptic lavage solution, bactericidal. These are the two important points. It should be a mechanical wash you should do with the brush. The diluted betadine, Dr. Javed Parvezi has already suggested, but is mainly for the prophylactic. It has probably less role as a biofilm destroying agent. So two important points is chlorhexidine and dilutic acetic acid. 3%, you should keep it for 20 minutes. These are the two agents which helps to destroy the biofilm. So these are the things which you chemical acting on the biofilm, you should use it, which are bactericidal. Bactisure lavage is also very useful in this type of things. And you must make sure that mechanical brushing, doing around the surface, along with this type of solution, they are going to be useful. There is a talk on the stimulant. So whatever antibiotic you want to add in this antibiotic beads, you should use that at the time of DAIR. Based on the susceptibility and virulence and the route, you should choose. Usually all we have discussed, this is about 12 weeks. That is very important. 6 to 8 weeks followed by the oral therapy. But rifampicin and quinolone, depends on not positive or negative, these are acting on the biofilm. So these two drugs are very important to give depending on the susceptibility. Your DAIR will not be successful if you know that this is MRSA, fungal, vancomycin resistant enterococcus or multi-drug resistant, and when there is a culture negative, you must tell your patient that these are the conditions or organisms which are not likely to give you a good result. So do not give a very rosy picture when you already know that there is an MRSA or a fungal or other things. The reinfection rate is higher in two-stage revision after DAIR compared to direct two-stage. So if you know there is an infection, you do the first stage and you do the second stage. Now if you know there is an infection, you do DAIR and then do two-stage, the results are different. So you must be careful about this. The patient's host factors are important for your success. So you must improve the hemoglobin, the albumin, and tell them not to use the nicotine, because this is going to affect your success rates also. If this is a multi-speciality approach, you must have a microbiologist, the ID specialist, plastic surgeon sometimes for the soft tissue covers. The results in various series, it's from 70 to 80 to 86% or even less than that. But it all depends on how much precautions you are taking, what protocols you are following. You must be very careful about those things. Timings, the modular exchange, antibiotics, type of organisms. Double DAIR. There is another condition which has come where they do it twice. After 1 week, they put the new implant. First time, they wash it and put the same and do the second debridement. So there are papers which has come out with condition known as double DAIR. In conclusion, the duration of infection, the type of infection, acute or post-op, right? Type of organisms, host status, your surgical technique, your debridement, post-operative regime, they all make important points in your success outcome. Early detection of the and take action, joint aspiration and tissue diagnosis is important, and you should do extensive debridement, chemical lavage, modular exchange, and also the physical lavage with the brush and other things. And suitable antibiotic and a long-term follow-up is required for these patients for the success. Thank you.